Hello, I'm your host, Neil Howard, here on Health Professional Radio. Thanks for taking the time and joining us once again. Going to have a conversation with Kiersten Combs. She's Vice President, U.S. Cardiovascular and Metabolic Disease. She's going to talk with us this morning about AstraZeneca's data that was presented concerning Farxiga. Welcome to the program, Kiersten Combs. How are you?
Hello, Neil. Thank you so much for having me today.
Okay. Just a bit of background about yourself.
So I have been with AstraZeneca 15 years and have held a number of different roles in our organization across many different therapeutic areas, both in sales and marketing, and have just kind of come back into this role where I'm responsible for our cardiovascular metabolic portfolio of products and all of the individuals who work on those across AstraZeneca. And that includes in the diabetes space, Farxiga and Bydureon, and in the cardiovascular space, right now we have a promoted product, Brilinta, for patients with ACS.
Now, recently, AstraZeneca, of course, presented Farxiga Phase III DECLARE data to the American Diabetes Association. Tell us about this DECLARE trial. What sets it apart from the other cardiovascular outcome trials that we've seen thus far?
Yeah, we're extremely proud of the DECLARE study and the results that it produced. DECLARE is actually the largest CV outcome study in the SGLT2 class. It was studied in over 17,000 patients, and it's also one of the broadest CV outcome studies in both in patients with established cardiovascular disease and those that didn't. And when you look at it, what we were able to demonstrate, and we're the first SGLT2 to be able to hospitalization of heart failure. So I think that when you look at the overall SGLT2 class and the data that's being presented with CV outcomes, this is a bit, it differentiates, I think, Farxiga in that it demonstrates CV benefits, but specifically in the heart failure space, which tends to be one of the earliest complications of diabetes, heart failure, and yet it goes undiagnosed, yet can be one of the most fatal complications for patients. So we're extremely proud of the results.
Was it effective across the board as far as men and women and as far as the progression of their particular disease? Yes.
So I think what we have seen is in this broad patient population, a really consistent result across both gender as well as degree of disease.
How does Farxiga actually work to facilitate this reduction in hospitalization?
Well, that's a really good question. And, I think the SGLT2 class in general works a little bit different than historical diabetes medicines in that it actually pulls sugar out of the body through the urine. I think that what is being studied, and probably the medical community will be able to comment on this more robustly. But what I think we find is that implication in the mechanism of action with the SGLT2 class and Farxiga, it has benefit not only in the cardiovascular space, but also in the renal space, in that it demonstrates improved outcomes for diabetic patients.
Does it affect in any way the possibility or maybe the reduction in dialysis based on this treatment early on?
Well, that's an interesting hypothesis. And the other piece of information that read out at ADA was a sub-analysis of renal, a composite renal endpoint within this DECLARE patient population. Now, it doesn't necessarily specifically answer your question about dialysis, but what we have been able to demonstrate with Farxiga is a 47% reduction in a composite renal endpoint that included end-stage renal, progression to end-stage renal disease. Mm-hmm. So I think that we definitely know there is impact on improving renal health by taking a medicine like Farxiga.
Do you think that future trials might investigate the use of Farxiga in other patient populations?
Yes. As a matter of fact, when we talk about DECLARE, whether it be the overall impact on hospitalization of heart failure or the renal impact that I just talked about, for Farxiga, that really is the beginning of what I think is a very robust clinical program. In the next 4 years, we will have 4 major outcome trials read out. And it's doing exactly what you're talking about. It's actually moving beyond just studying Farxiga in type 2 diabetics, but into a broader patient population. So later this year, we will read out a trial we call DAPA-HF for DAPA heart failure, which actually is studying heart failure impact in patients both with diabetes and without. Then later next year, we have another trial called DAPA-CKD, which will do the same thing in patients with chronic kidney disease.
Will we find more information at the AstraZeneca site, or is there a website where we can find more about this specific trial data?
Yes. I think that if listeners would like to find out more information, you can definitely go to AstraZeneca.com and take a look at our clinical trial section.
Kiersten, thank you so much for joining us here on Health Professional Radio. It's been a pleasure speaking with you.
Thank you so much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.